This is WFYI News Now. It's October 1st, and I'm Abriana Herron. On today's show, Purdue University ends a program to help low-income Indiana students go to college. Universities in central Indiana have fewer international students this fall. And the fear of getting picked up by ICE has become ever present for people living without legal status. And public health experts say a growing number of people are skipping visits to the doctor, even emergency care, because of that fear.
These families who would otherwise access services and address those illnesses and issues are literally staying home, trying to kind of cure themselves, see if it heals.
Those stories coming up. But first, Indianapolis Public Schools is offering a long-closed school building for $1. The school board recently voted to list the former Susan Roll Leach School 68 on the Near East Side for sale or lease to a charter school or other education group as required by law. The 1938 building closed in the late 2000s. Since then, IPS used it for storage and as a winter shelter for families. A district study rated it the lowest quality facility in the system. If no school is interested, IPS can sell it without the $1 rule. Purdue University abruptly ended a popular statewide program Tuesday to help low-income Indiana students go to college. Eric Weddle reports it comes after the Trump administration canceled the initiative's federal funding as part of its campaign against DEI.
Gear Up is a federal initiative that awards grants to states and universities to prepare low-income students for college. Purdue began its program nearly a decade ago. The university won a $35 million grant last year to continue Gear Up for 7 years. But the U.S. Education Department canceled the grant in early September. Federal officials said elements like diversity, equity, and inclusion training conflict with federal policy. The Indiana program served more than 13,000 students in 10 school districts across the state. It included after-school help, mentoring, and college campus visits. Purdue did not appeal the federal decision. I'm Eric Weddle.
Universities in central Indiana have fewer international students this fall, according to recent enrollment data. At IU Indianapolis, overall international student enrollment decreased by nearly 30% from fall 2024, according to an analysis by our reporting partners at Mirror Indy. At Purdue University in Indianapolis, international student enrollment increased this year, but the number of graduate students went down between 2024 and 2025. Purdue's main campus in West Lafayette also experienced a decrease of international student enrollment by nearly 7% overall, or about 640 students from last fall. The enrollment decline at IU and Purdue is tied to the Trump administration's policies on international students, according to a source from the American Council on Education. Such policies include revoking students' visas and legal statuses earlier this year and banning international students in 19 countries. And for our final story today, increased activity from Immigration and Customs Enforcement, or ICE, has made many people without legal status in Indiana fearful of daily life. As Ben Thorpe reports, public health experts say a growing number of people are skipping visits to the doctor, even emergency care, because of their fears of deportation.
The fear of getting picked up by ICE has become ever present for people living in Indianapolis without legal status. One of those people is L, who works at a small business. He did not want his name or voice to be used for fear of being visited by ICE. The voice you'll hear is an interpreter.
There's definitely a lot of police activity and a lot of movement from other officials that make it very scary to go anywhere that you would usually need to go to. I would definitely think twice before going into a doctor's office at this time.
L says his family avoids hardware stores, even grocery stores, out of fear.
It's really sad that we have to question twice before we leave and have to question so much if we're ever going to see our loved ones again.
Earlier this year, the Trump administration ended a Biden-era policy protecting so-called sensitive areas like churches, schools, and hospitals from immigration enforcement. Those policies were meant to protect people seeking essential care, says Natalie Guerrero, assistant professor of pediatrics at the IU School of Medicine.
Not accessing services early enough, having late detection of disease, late detection of illness, ultimately leads to poor health outcomes. And we know that, and that's been demonstrated time and time again.
Guerrero says some people aren't accessing care because of their legal status. But she says others might not use benefits they qualify for because they worry it would hurt their applications for things like a green card. When going through the immigration process, the government can consider whether the individual would use public resources, but it has traditionally not penalized using things like SNAP or Medicaid. Immigrants and lawyers worry this could change under the new administration. Several providers WFYI spoke with said that they were familiar with individuals avoiding care. Guerrero and others describe people ignoring back pain or skipping pregnancy appointments, the kinds of decisions that can lead to long-term consequences.
These families who would otherwise access services and address those illnesses and issues are literally staying home, trying to kind of cure themselves, see if it heals.
Healthcare clinics have been afraid to take a stance on how they would respond to ICE, noting the funding they receive from the federal government could be jeopardized. Many immigrants, especially those without legal status, have long preferred these clinics and community health centers, which often don't ask about immigration status and treat people regardless of their ability to pay.
Should I trust the clinic that I go to? Should I trust the center that I visit?
This is Wendy Catalan with the Undocumented Youth Alliance. She says the lack of clarity and guidance is part of what worries people.
One, we're very transparent in the fact that almost everything is a risk, right? We don't know if you sign up for emergency Medicaid, if that's going to make you a target.
WFYI asked several hospitals how they would respond to a visit from ICE. They offered varying degrees of clarity. Some, like IU Health, said law enforcement does not have access to patient care areas without authorization from a court. Community Health said law enforcement activity would be conducted in a manner that, quote, minimizes disruption. Eskenazi Health would not disclose its policies and directed questions to the Indiana Hospital Association. For immigrants like L, the ongoing fear of ICE has only increased his existing fear of going to the doctor and waiting to find out afterwards how much it will cost.
And I know many people as well that just opt for staying at home and doing more herbal remedies or homemade remedies.
Elle says it's just one more thing that makes these visits feel like they're not worth it. I'm Ben Thorpe.
That's all for today's episode of WFYI News Now. Our podcast is produced by Zach Bundy with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.